we will talk about supplements for heart. When we say supplements for heart, we usually mean that they protect blood vessels. Usually they reduce inflammation. It means they reduce chance of atherosclerosis, or they improve atherosclerosis. It prevents formation of blood clot, and prevention of blood clot means prevention of heart attack or stroke. So usually supplements for heart prevent heart attack. It's most important part of supplements for heart. Another function and another characteristic of supplements for heart is improve cardiomyocyte function. Some of them improve cardiac contraction and cardiomyocyte energy, and they are also considered as supplements for heart. Most well-known and most important and most evidenced supplement for heart is omega-3 fatty acids. They derived from fish oil, and we have strongest evidence that omega-3 in taking 4 years, people who had cardiovascular risks, there was decreased chance of heart attack and stroke around 25%. It's huge improvement, and it also decreased death risk from cardiac events. So omega-3 fatty acids decrease heart attack, decrease stroke, and decrease risk death from heart attack. And here is question how they act. What is the mechanism of action? Most important part of omega-3 fatty acids is especially EPA. EPA is form of omega-3 which is considered best for heart. We have EPA and DHA. EPA is for heart, DHA is for brain. And EPA is most important because it has strong anti-inflammatory action. It means it reduces inflammation. It reduces blood vessel damage. Also, it has blood thinning effect, and this blood thinning effect further decreases risk of blood clot formation. Also, it decreases triglycerides level, and triglycerides, low triglycerides means less chance of cholesterol and cholesterol plaques and atherosclerosis. So they have 3 main actions which can prevent heart attack and heart problems. Also, they stabilize membranes of cells and they decrease risk arrhythmias also. So we can say that we have very important supplement for heart, and it's omega-3 fatty acids. Another important supplement is Coenzyme Q10. Coenzyme Q10 is important because we have huge studies about it, and it was very highly respected study, and in this study patients intake coenzyme Q10 for 2 years, and these patients had heart failure, so they were heart failure patients who had heart failure, and in such patients coenzyme Q10 decreased risk of death from heart failure around 40%. So it's very important improvement. This patient were intake coenzyme Q10 100 milligram 3 times per day. That was regimen, and in such people coenzyme Q10 decreased risk of death by 40%. It's highly respectable study. That's why we can say that coenzyme Q10 is really effective. How it acts? It's important that it helps mitochondria to generate ATP or energy. So it helps cells to generate energy. Also, when people intake statins against cholesterol, and statins are medications against cholesterol, first-line treatment of cholesterol, we have coenzyme Q10 depletion. coenzyme Q10 deficiency at this case, and people who intake statins and coenzyme Q10 at same time, they have improved function of muscles, because at this case energy deficiency is prevented because of coenzyme Q10. So we can say that in people who has heart failure, coenzyme Q10 is effective. Also in people who intake statins, coenzyme Q10 is effective. Also, it lowers blood pressure, but this improvement is very mild and it's not very important. And it also can prevent migraine attacks. And intake of coenzyme Q10 is safe around 2 years. There's also some studies about weight loss and coenzyme Q10, but it's not effective. Most studies say that it's not effective. There is mixed results, and there is all theoretical versions that and statements that coenzyme Q10 can boost metabolism and can increase energy consumption and energy production from fat, but it's not true. Usually this study shows that it does not help. It does not help importantly for weight loss. Maybe there may be some minimal effect, but it's not very important. And third important supplement for heart is L-carnitine. What L-carnitine is doing, it looks like coenzyme Q10. It helps our body to produce energy, but it more helps our body to get energy from fatty acids. When fatty acid oxidation is important, it helps fatty acid transport and helps our body to burn fatty acids. Here is same also. Maybe you think that it can boost metabolism, it can cause weight loss, but it's not true. Usually it's not true. There can be some minimal effects, but for weight loss it's not effective, but for heart it's effective. There is some important studies. According to them, it can prevent angina, it can prevent heart attack, and it may help for weight loss minimally, not importantly. So it's better not to consider L-carnitine as a weight loss effective medication, because we have no enough evidences. But we have enough evidences that we can say that L-carnitine has some effect to help our heart. And fourth important supplement is green tea extract. Green tea extract is full of antioxidants, catechins especially, and it improves blood pressure, it dilates blood vessels, it decreases cholesterol slightly. Green tea effect is minimal, it's not very important but consistent. It means that it's effective in most cases, but this effect is minimal. And from food, fish is very important, especially any fatty fish, because of high content of omega-3 fatty acids. Leafy greens are important for heart, especially spinach, kale, lettuce, or cabbage, or everything what is green usually is healthy because they contain nitrates, and nitrates help synthesize nitric oxide, and nitric oxide causes blood vessel dilation and lowers blood pressure and helps heart. Berries are important also because they are very strong antioxidants. Among fruits and vegetables, berries are strongest antioxidants. So you can remember that berries are strongest antioxidants. If we consider, for example, apple is 6 out of 10 and berries are 9 out of 10, because berries are strongest antioxidants, including raspberry, blueberry, strawberry, cranberry, every berry are strong antioxidants. And nuts are important for heart also because they have high fiber content. They contain omega-3 fatty acids also, especially walnut, for example. So nuts are also important. Thank you for your interest. Thank you for your watching. If you like my videos, please thumbs up. If you like my channel, please subscribe. Thank you very much. Bye for now.